When I grow up, I want to be a doctor.
I wish the world can be free from cancer. I used to say to myself, I wonder where's this thing coming from, because you don't know how it starts, you don't know how it will end. And like how limits, you know you were cut by a knife. This thing you don't know. Nna ka lebitso ke Dikeledi wa ha Modibokgo. Ngwanaka ke Molemo, le ena kwa ha Modibokgo. She's 5 years old. Hore re tsebe hore Molemo o na le leukemia. O na ntsa kula, like nako e ngata na tshwara ke flu, then ra ya clinic, a misa clinic. Ha re fihla clinic, they thought hore ke pneumonia. But then ba re fa medication a sa fole. Then re ntse re khutlela ngata until doctor a decided or no what's king re monke o ye para ro referele para, and then para will tell her into the flu or not. And then ola admitiwa ka di 30th of July, then the tests. From there ka di 10th of August, that was when we knew hore ona le leukemia, and then ba sentse ba re jetsa hore start chemo immediately. So ha se re thotse sa tlameha jaanong a re ba le sepetlela le one, of which ke tshwana sa itsebe hore a be one, like away from me. So Lena, at times I felt like maybe nkare ke a molahla or something, especially ha ke robetse ke le one ko ntlong ena a seo ke la bona. So no se sharp lo ho mbona nako engwe I ya through those procedures. It wasn't easy. Like I felt or nkare nka her place, and then yena even nna ke be yena ke be like through that whole process.
Do you want to tell these people why you are ringing this bell? Tell them. Tell them, and after telling them, ring it as much as you want, as hard as you can.
Ho bona ngwanaka a ringa bell today, o nthabisitse haholo. Like it felt good.
Can you make this bad because it's special?
The experience of having everyone around, seeing my child ringing the bell, like it felt great. They can see hore this thing is possible. Hore it's possible, hore cancer, we can beat it.
These new units, equipped with the state-of-art technology, are designed to provide optimal care for patients facing the challenges of cancer and severe burn injuries. So they stand as a testament to our dedication to offering comprehensive, cutting-edge treatment options to those that are in need. The reopening of this unit is more than just a ceremonial event. It is a significant step towards making quality healthcare services more accessible to our local communities. We believe that access to healthcare is a fundamental right, not a privilege reserved by a few. By bringing these facilities closer to our people, we are breaking down barriers to healthcare access.
the conference. Primarily, it's a pharmaceutical services conference. For 2023, our theme is pharmacy resilience in an era of disruptions, informed mainly by all the disruptions taking place around us. COVID was one, but beyond that, there's many other things happening here. There's automation of services, digitalizations. The public health programs are bringing a lot of changes on how treatments are handled. There's quite a number of them that we need to talk. So these are all the disruptions that are going to impact how we practice, and it's important that we prepare our managers for these disruptions.
The renewed sense of purpose and pride that resonates within the walls is a proof to the indomitable spirit of each individual here. Ladies and gentlemen, within our hospital, there lie certain tasks that, while not deemed major, hold crucial significance. These tasks pertain notably of our hospital pharmacies, an area where challenges persist, especially when compared to experiences in other medical facilities. Presently, the average waiting time at most of our hospital pharmacies, with the exception of central hospitals, hovers around 30 minutes. Given that stage represents the final leg of patient service delivery, it understandably leads to heightened levels of frustration among our valued patients. And I'm happy today because I got a report that Eden Vale Hospital is leading again in terms of improving what I wanted last year, that let's operate like a bank in our pharmacies. By addressing these pertinent concerns within our hospital pharmacy, we are not only enhancing the overall patient's experience, but also solidifying our standing as a healthcare institution that is dedicated to excellence in care delivery. It is through these focused interventions that we fortify the foundations of our department, ensuring that it remains a cornerstone of quality healthcare provision in our communities. Together, we embark on this journey towards improved service delivery, cementing our commitment to the well-being of our patients.
The digital fingerprint Gauteng. The innovation recognized with this award is digital fingerprinting. Currently, the procedure used to identify a deceased person is by word of mouth from family members or friends after identifying the body. This information is put on a DHA 1663 form with ink fingerprints of the deceased affixed on the above mentioned form. This information is never verified through the population register. Biometrics are commonly used by financial institutions to verify owners of bank accounts. By thinking out of the box, the innovator decided to buy a biometric scanner to test if the verification of a deceased identity is possible with this system that is used for alive human beings. The use of the electronic biometric fingerprint scanners for the capturing and verification of the deceased was never used in the Department of Health as a solution for identifying of deceased persons. This improves the scientific identification of the deceased with biometric data that was collected when he or she was still alive. By doing this type of verification, the turnaround time of service rendered to the families was improved. This intervention has reduced the number of pauper burials and claims against the state for wrongful burials. This information enhances the capability of the department to improve on the speed and effectiveness of identifying the deceased. The
Many people are not aware that children can get cancer. When we think about cancer, we think about old people. September is celebrated globally and annually as the Childhood Cancer Awareness Month. For many of us, it is known as the month of gold because gold is the symbolic color of children. Our children are precious. So when we look at the different diseases that children can get, not only in our country but the world over, 30% of all children that we see are diagnosed with leukemia. When we say leukemia, I mean acute lymphoblastic leukemia, acute myeloid leukemia, and chronic myeloid leukemia. But by far the most common disease is acute lymphoblastic leukemia. I'm Geetha Naidu. I'm a pediatric oncologist and I'm the head of pediatric oncology at Chris Hani Baragwanath Academic Hospital. I'm also the academic head of pediatric oncology at the University of the Witwatersrand. And currently I'm the chair of the South African Association of Pediatric Hematology Oncology. Lymphoblastic leukemia is a life-threatening disease. It is a disease that we have to diagnose early. Many children the world over can be cured of leukemia. So the most important signs that we want to talk about in leukemia is children who may develop lumps and bumps,
in the neck or in the abdomen or other parts of the body that do not go away but actually make it larger. They don't necessarily have to be painful. Children also will be pale. They will sometimes have a fever, may have infections that don't go away, may lose weight, may have a poor appetite, and sometimes may also present with pain in the bones, especially the long bones in the upper limb and in the lower limb. So these are the most frequent signs of acute lymphoblastic leukemia. And with these signs, we call these constellation of signs, we have to be suspicious of the diagnosis of acute lymphoblastic leukemia or myeloid leukemia. The most important treatment for leukemia is chemotherapy. And if we look at acute lymphoblastic leukemia, it is one of the wonder stories of our time. 40 to 50 years ago, if a child was diagnosed with leukemia, the child was put onto palliative treatment, some morphine for pain, and the child was sent home. But now, if we look at high-income countries, the survival from acute lymphoblastic leukemia is between 85 to 90%. So it really is a success story of modern medicine. The thing about leukemia is that if we had to have modern treatment, conventional treatment with all the old drugs, we can get a good survival. But there are some children who have a really poor biology with a very high-risk type of leukemia. For them, we will consider some of the new and novel targeted therapies. And the entity of bone marrow transplantation is also one of the reasons why children living in high-income countries have raised the survival. The survival for these children is raised to over 85 to 90%. It is because they are very fortunate that they are able to have access to allogeneic stem cell transplantation. The problem for us in South Africa is we have a lack of donors. Many of our children do not have matched sibling donors. They may be half siblings, so you cannot get a full matched sibling donor, which would be the ideal, which would be the best. Then we know if we cannot get that, then we looked for an unrelated matched donor. And this is where the problem comes in. In South Africa, we have very few donors on the registry. So it is a really big problem to offer our patients this curative treatment of stem cell treatment or bone marrow transplantation. Many people are not aware that children can get cancer. When we think about cancer, we think about old people. September is celebrated globally and annually as the Childhood Cancer Awareness Month. For many of us, it is known as the month of gold because gold is the symbolic color of children. Our children are precious. So when we look at the different diseases that children can get, not only in our country but the world over, 30% of all children that we see are diagnosed with leukemia. When we say leukemia, I mean acute lymphoblastic leukemia, acute myeloid leukemia, and chronic myeloid leukemia. But by far the most common disease is acute lymphoblastic leukemia. I'm Geetha Naidu. I'm a pediatric oncologist and I'm the head of pediatric